One thing I've learned the hard way, you don't rise to the level of your ambition, you fall to the level of your biology. Today's show isn't about anti-aging. Today's show is about remaining dangerous forever. I'm sitting down one-on-one with Darren Slosberg to talk about what actually it takes to stay dangerous, not at 25, but when pressure is real and excuses won't cut it anymore. All right, let's talk to Darren. Darren, amazing longevity lounge, Protocol 4. So how'd you get into this?
Honestly, on accident. A few years ago, I sold my company, retired at 48, probably for about 2 weeks. But I was going through a divorce, I was overweight, and my goal was just to try and be the best version of myself. And so I come from a manufacturing and logistics background. So I'm a researcher. Don't really trust a lot of people, so I do a lot of research to find out what the best products are, how I go about making myself look better or feel better. And so I started buying these machines, honestly, for me. I was kind of like what Brian Johnson did, had a little bit of extra money, and I started spending a lot of money on these machines to see what works, maybe what doesn't.
Brian Johnson's the guy who's in the 60s who says
don't die.
Don't die.
He thinks he's going to live forever. Listen, I hope he does. But he's onto something. He's different from I am. He's like a gerbil where he's being perfect. I'm not perfect. I don't think any of us are perfect. What I'd like to do is spend an hour a day trying to live longer. And so I'm willing to give myself an hour to work out with weights, to do some do some of these modalities that we'll talk about, to stay healthy and be healthy and look healthy.
Yeah. The modalities, we walked through a bunch of them, and we're going to splash some of the video as we talk. I'm fascinated by a lot of them. And for me, I've done a lot of research. I've worked out a lot. I've read a lot of science. Inflammation is a killer, deadly to the body. And is that basically what you're trying to reduce in the longevity lounge?
Yeah. At the end of the day, all of these modalities, and there's a few, right? You got hyperbaric chambers, you got red light, or what we call photobiomodulation, PEMF, energy frequencies. All of these modalities at some level lower inflammation, because inflammation is the root cause of disease and things that go wrong in your body. And so depending on your health challenge or your deficiency, we utilize these modalities in certain orders, and amplify them to lower that inflammation so your body can actually fix itself. These modalities, these peptides that everyone's talking about, they don't actually fix anything in your body. What they do is they put your body in it's a good environment for your body to heal itself. And that's what it's about.
So how much of it is biology and how much of it is mental?
It's a great question. I am not on the mental side. I'm very medically focused. I don't sell voodoo. I don't buy voodoo. I have in the past on accident. I am focused on things that we know have clinical trials that actually work. And so there's stuff that's theoretical. There's things like hydrogen water, that there's a lot of things out there that people are pushing, a lot of different peptides that seem to work really well. And then there's that are theoretical. And then there's medical, where you're dealing with hyperbaric chamber that's been around for decades, red light or photobiomodulation that's been around for decades. These are things that we know work. So I kind of separate medical from theoretical at the lounge.
Do any of your modalities enhance or supplement peptides, testosterone, creatine, et cetera?
All of them do. So if you're on TRT, if you're taking creatine, which I believe in for men and honestly for women, all of these modalities will amplify the experience. And especially with peptides. So there's peptides out there, methylene blue, BPC 157. There's a peptide that looks like Vitamin Shop or GNC now, where there's a peptide for every single thing. And it's extremely overwhelming, and people don't trust it, rightfully so, because who knows where you're getting that peptide from. You got to trust the manufacturer, the distributor, all that stuff. But at the end of the day, scientifically, these things really do work if you put them in the right percentage, in the right order, at the right amplification. That's how that works.
What can I address with these? Joint pain.
Yeah.
Visceral fat. What works with your modalities?
So when you're dealing with visceral fat, everyone's getting into the GLPs, GLP-1, glucagon, all these receptors and they're amazing. We don't actually sell those, or we don't actually make those. But we help by utilizing a GLP-1 to lose weight, along with using red light therapy. Because as you lose weight, your skin, your elasticity loosens. So you might have issues with your face or your body. So utilizing red light therapy, utilizing different types of hyperbaric sessions can really help with that.
Your hyperbaric, I'm going to call it a chamber. What do you call it a chamber?
Yeah, absolutely.
Because I sat in it, it didn't feel like a chamber to me. It was like a first class seat on an airplane.
Yep.
Felt like that same feeling, and the pressure, is it similar pressure to one of those tube things where you got lay in and feel like you're in a coffin?
Each one, they have what's called soft shell chambers and hard shell chambers. But the alt hard shell chambers look like you're in a coffin. And they're amazing. They work really well. And then there's different levels of atmospheric temperature or pressure that works.
Can you get the same pressure with yours?
Absolutely.
What is the peak?
There's different levels. 2.0 is more on the medical grade side. We actually use people at 1.3, 1.5. There's variables in those chambers now that you can lower it depending on the health challenge. So some people can't handle 2.0. Some people that have issues with their ears, lungs, they have to.
Your ears
lower
pop.
temperature. Yeah, it feels like you're in an airplane, or more like a submarine.
What is the pressure in an airplane, by the way? Do we know? Is it similar to what you're doing?
So it's better like a submarine. It talks about how many feet down you are. So at like a 2.0, you're almost 60 feet down in a submarine. So that pressure, along with oxygen, really gives your blood and gives your plasma we all need oxygen, right? Now we breathe 21% oxygen. Right now, you and I are breathing 21% oxygen. When you go into that chamber, you're breathing 100% oxygen with pressure. And so what that does is it forces the oxygen into your plasma, into your tissues, into your tendons to lower that inflammation.
How does that happen? Do we know?
It's just through pressure and oxygen.
I mean, the oxygen is a facilitator of releasing inflammation in tissue.
At the end of the day, we need oxygen, we need H2O, we need hydrogen, we need water in order to lower that inflammation. And if we want to get specific, I can always have you meet with. Obviously, it's not just me. I am not a doctor. I'm a user. I'm a person that, just like Brian Johnson, I tried to do this for myself, and I'm learning. But you get the doctors, our medical director, our clinical director. My clinical director is an expert in hyperbaric. He actually teaches other doctors how to use it properly all over the world.
Right.
So these are the types of people.
A couple of weeks ago, we had my plastic surgeon in that exact chair, and what they recommend, and this is fairly new, I believe, that they and other plastic surgeons recommend hyperbaric therapy after plastic surgery for.
So remember, you're talking about, it's sometimes before and after, but if you focus on after, you just had surgery, whether it's on your face, on your knee, there's inflammation there. They don't want to have to go back and redo someone's knee or have a bacterial infection. So if you do surgery, whether it's for a facelift or a knee replacement, you jump into that hyperbaric for the next week or two after that, and it lowers the risk of having some type of bacterial infection because it lowers the inflammation and allows your body to heal faster. The recovery is much faster.
I've told the audience we're completely transparent here. I'm on testosterone injectable replacement therapy. I am too. 2 weeks ago started a peptide stack.
Which one?
BPC 157.
GHKC, your Wolverine stack?
I don't know what that is.
Okay.
I'm new to this.
Okay.
There were two for recovery, muscle recovery after working out, and there were two for reducing belly fat.
Yep.
Yeah, and not a GLP, but
testosterone
and ipamorelin. So I actually feel great since I've been on the peptide therapy. What is a myth about your lounge that will I get better than what I'm experiencing from peptides and testosterone? Will it enhance it?
Well, so it's not an either or, it's an and, right? The goal is that we believe in peptides. I use peptides, I use testosterone. And it works, and it gives you energy if you have brain fog. All of these peptides are unbelievable if you buy from the right source. There are sources on Amazon that just literally are placebo. Then you buy from a pharmacy and they really work, especially injectables. The lounge or these, it's not about my lounge, these modalities, wherever you are in the world, amplify that experience because they help with the inflammation, they help with the recovery process. So even if you're on testosterone and now you're working out with weights, think about Messi, all of these athletes, they're all going into hyperbaric chambers just after recovery from working out. It helps with the recovery so your muscles heal faster, so they grow quicker. That's what it does. So it's an and, not an either or.
So I have a thesis that you don't rise to your level of ambition or motivation, you drop to your level of biology. In other words, you can think you're going to be amazing and cut and ripped, and you're going to lift weights and be incredible and fit. But if your biology doesn't allow you, I'll give you an example. I've bone on bone in my shoulder. I would love to be doing a lot more exercise in the gym, but I couldn't. As I'm on some of these therapies, I'm able to do more and more in the gym. Maybe it's more working out, maybe it's the testosterone, maybe it's the peptides, whatever it is. What do you think of that? That your biology will allow you to achieve as much as you possibly can?
I think in the past, genetics are genetics. We all have predispositions for things. But as these technologies get better, I believe that just like Brian Johnson, maybe not at his level, we are surpassing what maybe we could have done in the past with these new peptides, with testosterone. 50 years ago, no one took testosterone except if you were a bodybuilder. Now, maybe 10% of the male population is taking testosterone, and they're seeing the effects of their life changing, their being better, and it amplifies that experience. You talk about having the edge. This is not cheating. This is regaining control of what you were like when you were 20, when you're 50 or 60.
So important.
100%.
So important. I always say it's not about being motivated, it's about being dangerous.
Absolutely. Stay
Stay dangerous. How does a guy in his 50s or 60s stay dangerous?
Here's the issue, I think, and this is just my take. It is what it is, doesn't exist for us, at least for me. It's not about what you can control, what you can't control. Once you decide that you're going to be better or do better or try, that really will make a much better situation for you. So it is what it is. We're like, I'm 60. I'm supposed to have aches and pains. Your shoulders. You're supposed to have shoulder surgery. You're supposed to be fat and feel like shit. I don't believe that. I believe with testosterone, these peptides, these type of modalities, with what we know now about nutrition, what we know about now with working out with weights and diet and exercise, that at 60 you can feel like you're 20.
Important question, because I think this is a sliding scale. At what point do men, and this is obviously geared towards male performance, start to decline in performance? Not because of choice, because of biology.
So I think what they're saying, what I've learned is that NAD+, which is a peptide that a lot of people are using, once you hit 40, it starts really falling off a cliff. And so a lot of people now are on, whether it's NMN or NAD, injectables, oral. I mean, we can go into all this stuff whenever you want, but NAD is really the source of ATP or energy. And at 40 is where you really start going downhill. And that's where a lot of these athletes, that's where a lot of people need a little extra help. And it doesn't have to be testosterone. I know a lot of people that have testosterone levels of 800 and they're 70. They don't need testosterone. I had low testosterone. I was at 340. So I take testosterone and now I'm at 750. And I don't need to be at 1200. I'm not going to be a bodybuilder. I want to be healthy. I want to look the part. So that's where these therapies are going.
So the takeaway is make sure the biology is intact, whether it's replacing a low testosterone level with injectables or adding peptide stacks or supplements, and then working out. Working out was a game changer. I'm probably in better shape right now at 60 than I was at 40. Probably no question about that. But then adding some of the modalities that you talk about. What are the most important modalities literally across the street from this podcast is where Darren's lab is?
I think before we go to the modalities, I think the most important thing is we're all still guessing. I don't know if you tested your blood work before you went on testosterone. Or you tried a peptide before you actually looked at your gut biome and looked at your epigenetics. And
by the way, let's just clear this up. I have a doctor who is very, very diligent about.
Awesome.
When we first started, it was a month in, then every 3 months, and it's progressed to every 4 months or so, full blood work, just to make sure I'm not peaking on something or creating some hormone that I don't want, male breast tissue and things like that.
So I think testing is the most important. The key element is test before you start.
So
Otherwise,
you do this over, you blood test?
absolutely. We do blood tests. We do epigenetics. I believe, regardless of
Sorry,
who you go to,
what are epigenetics?
epigenetics are your gene expression. There's certain things that people have. Like I do not tolerate complex carbohydrates well. I don't tolerate dairy very well. A lot of people don't.
We are the same body. I mean, I'm a lactose intolerant, and I will tell you, if I eat high calorie, low carb food, I'm fine. If I eat high carb, low calorie thing, horrible, right? It's sensitive to carbs and lactose, yeah.
But you learn that, I guess, but you have to actually, there's math now. These tests that they're coming out with even with blood work and epigenetics, the testing can really tell you your story. And from your story, just like your doctor is probably doing, you're creating a different story now, because that's not your story anymore. That's your baseline story. Now with the help of exercise, nutrition, peptides, these other type of modalities, you can change that story. Yeah. And that's what we're trying to do.
What are, let's call it, if you want to perform or stay dangerous, what are the non-negotiables for a man?
Listen, the most important thing is sleep, right? In order to recover, yes, you have hyperbaric, you have all this stuff. Sleep by far is the most critical. And then you need to exercise, whether it's walking with a vest, you got Gary Bruck, you got all these guys telling you how to do it. Do something. Don't give up. You don't need to do a triathlon, but walk, run, do push-ups. You need to do nutrition, you need to do exercise, and you need to sleep. You do those things and you're in a really good space.
Do you have you had a situation where a guy walks into your salon, your lounge, and says, "I'm ready to go," and you find something that he can't start, can't do this?
It's not that he can't do it. What we found in some of his gene expressions or some of his blood work is that I want to jump into hyperbaric, and so he had a heart attack, or he had a transplant. And he had an old metal transplant in his heart.
Pacemaker.
He's not allowed to go into the hyperbaric with that.
Okay.
The new ones you can, but the old ones you can. So we had to change his protocol, and that's what it's about. It's about looking at their genetics, what's going on in their body, what happened in their past, and then creating a protocol for what they need to do. So he couldn't do the hyperbaric even though he wanted to.
Anything else besides what we're talking about? The testosterones, the peptides, the hyperbaric chambers, working out, running, sleep. Is there another piece of this recipe ingredient?
There will be. I mean, as you can't keep up. I mean, you look at AI, you cannot keep up with the technology. At the end, lowering inflammation, having rest, eating well, and exercise is what you need to have. Clean air.
Can you drink? Can you recreational drug too, and still want to be dangerous and stay dangerous at 40, 50, and 60?
Yes, could you? But how much? Is it one glass of wine a day? Is it a bottle of tequila a day? Like, there's all these different types of levels. I drink occasionally. It's January, so I'm not drinking.
Yeah, until January 20th.
Well, and I'm going to try for the year, but I'm focused on the month, right? And you always try and be better, right? That's the goal. Maybe I can go into the end of February. But yeah, if you're going to drink tequila. Drink one.
Why? Because it's the most refined.
It's clean. Okay. Yeah, it's about the sugar aspect, right? So, you got to live too. The goal here isn't just to be a lab rat and just, I need to be perfect. I want to live it to 150. There's a difference between being alive and living. I want to live. I don't want to just be alive. I want to have fun.
Right.
So you got to do both.
A couple of things very quickly. We were over there, and I've done the full cold plunge, infrared sauna and cold plunge at a place, sweat house. I didn't love it. It was too much of an ordeal. It took me an hour and a half to get 30, 40 minutes of therapy in.
Yep.
You have a dry cold plunge, and I tried it. It was pretty amazing.
It's called a cryo float. It's basically a glorified water bed that's 42 degrees that you walk. I have a cold plunge. I literally have a cold plunge at my place. I bought the cold plunge. Never use. I can't use it. I just can't get in there. Maybe I'm a wimp, I don't know what it is, but I just won't use it every day. These new cryo floats, there's two things. The goal is to lower your core temperature, not to get it. You can get a dopamine drip, but you can get that in many different ways. But in order to get contrast therapy for hot and cold, you just need to lower your core temperature. And so that's what this bed does.
It speeds up your metabolism. I think that's the theory.
It does. It speeds up your metabolism, temporarily lowers inflammation. My problem with cryo, and it could be wrong. I'm a consumer. This is my belief. This is what I've known. This is what I've been doing. Is that cryotherapy, cold plunges, even that cryo bed, it's temporary vasoconstriction, relief. It's not going to fix like a peptide will or acoustic therapy will. It doesn't fix the actual
We need to point out something. Just I want YouTube to go crazy about this. Peptides are not FDA approved. Most of them are not right now.
That's why
GLP-1 is,
research
but the other. So let's be clear. The peptides that I'm taking are put together by a pharmacy, with a compounding pharmacy, right?
It's cool. So for research.
Absolutely check with your physician before you order any of these or start doing any of these therapies. I want to make that absolutely perfectly clear.
Well, we did. We talked about testing, right? Test your blood first. Find out where your deficiencies are, and then
right. But I'm actually telling folks I'm taking a non-FDA approved, injecting one into my body. Yep. So,
agreed.
Make your own decisions. Talk to your healthcare provider before you do anything. I just had to clear that up.
Sure.
One of the coolest things when I went over there, and I just can't stop thinking about it, there was a stuffed animal. There's a little dog in one of your little cryo chambers. Tell us about that.
So that's actually a hyperbaric chamber.
Oh, right. Got it.
So just like humans, animals have issues as they get older, and they have osteoarthritis, and they go senile, and the same type of chemistry, right? So there are products out there now that we utilize for hyperbaric, for red light, for animals. Mm-hmm. We have a lot of people, celebrities, buying the large red light bed, like the big one that you laid in, for their dogs, because they're
a bigger dog.
The mastiffs. I mean, you're talking monster dogs.
I guess the dog will stay in the little chamber.
Love it. I have video of dogs staying in those chambers and just resting because it makes them feel better, makes them walk better. And they like it.
How much is a full plate of therapy at your place cost?
It depends on what you're going to do and for how long. But normally we'll do memberships at that range. You want to do as many products as you want throughout the month. It's $1,000 a month. We also have weeks where you want to try it for a week just to see what you like. That's $350 for the week. And then we have a day pass where you can just let me see if I even like this stuff, regardless of what my doctor says. Some people cannot get into a hyperbaric. Even the sit-down hyperbarics, they're just claustrophobic. They cannot get into an MRI. It doesn't matter if it's with their head out or not. They're not going in that hyperbaric, and that's okay. We change that protocol for them based on what they're actually going to do, not based off what we want them to do.
And how much is a day pass?
Day pass is $350 for the day pass, but you get to use all the machines.
Clear up a myth that you keep hearing, whether it's celebrity myth, science myth, that you see is not provable based on what you're seeing in your labs.
I think it's not a myth. I think it's a trust issue. There's two things that people are worried about. There's fear and there's lack of trust. Rightfully so. People my age, your age, this is all new technology. It is a lot of this. The red light is and stuff, but peptides, as you said, they're not FDA approved. So you have a lot of people out there going for the money, right? And they're like, this works, this does this, and they're just basically saying things that aren't true. And so when you have 90% out there that are just trying to go for a money grab, and 10% of us actually trying to make an impact and a difference, people aren't going to have trust, and they're not even going to try it. So I think what we need to do as a team, as we work to get people comfortable, is let go of the fear. Try some of these things. It doesn't mean try a peptide just to try a peptide, but specifically the modalities, you got to start trying these things to see what you're willing to do. And you got to work with your doctor and see if you can trust the equipment, the peptides, who you're working with, in order to make an actual difference. And I think those are the two biggest things, trust and fear.
Celebrities, you don't have to tell us if they're your clients or not. Celebrities are using these types of modalities?
A lot of celebrities, a lot of athletes are using these types of
Anyone we can you know? I mean, you must be reading a lot of literature on people who are using them. Not necessarily yours. You don't have to say yours or not, but
listen, I know a lot. I mean, you look at LeBron James, right? You look at Ronaldo. They're talking about utilizing these type of technologies. You know, and LeBron James, I think they say he spends $1 million a year. I'm not sure how, but you know,
on what?
On his longevity type system, where he might be doing hyperbaric every day, or he has a hyperbaric or a longevity lounge in his house. We do a lot of that. We have a lot of celebrities, a lot of athletes that have these lounges in their home.
Okay, so kind of two questions, opposites. What is the biggest game changer of all of these things that you would say the biggest game changer to men who want to stay dangerous after 40?
For me, the biggest game changer has been hyperbaric. If I had a certain amount of money, and I have all the difference is when you go to these lounges, either someone's trying to sell you red light therapy, or they're trying to sell you cryotherapy, because that's all they have. So what I tried to do is not have an agenda on the product. My agenda was your experience of.
What's the one that
hyperbaric by far? If I had a certain amount of money, I would just be in a hyperbaric chamber.
And then what's the one thing we can call junk, garbage?
I hate to say this because it's going to go against the masses, but that cryo plunge or a cold plunge or it works. It absolutely works, but it's temporary. It's like getting a massage or taking a Tylenol pill. It's not going to change your shoulder. It's going to fix it for the day, but you're going to have to do that every day. Every single day you're going to have to do that. Nothing's going to change that pain that you have in your shoulder unless you go into the cold plunge.
Very good. Darren Slosberg.
One thing, the only other thing I would love to add is, you know, we talk about the modalities. We talk about being the best version of ourselves. I think it's important that people understand what their health challenges are first, understand why they're going to a med spa or a clinic or a doctor to be like, where am I? Get the test done to find out where you are, and then find a place that can actually use protocols in order to create specific, basically get that health challenge and focus on getting rid of it. That's the goal. It's to create the protocols, not just to try a red light bed or try cryotherapy just because everyone else is doing it.
Got it. Darren, really good having you. I appreciate the enlightenment. It was amazing walking into your, what do we call it? Longevity Lounge. I keep calling it a lab. It's a lounge. Darren Slosberg, Protocol 4, Boca Raton, and West Palm Beach.
Yes, West Palm Beach as well.
There you go. Thank you, brother.
Thanks, man.
All right, if you enjoyed that show, just do me a favor, hit subscribe. The Edge, we're here, we're growing, we're a movement. We want you to join us.